In this video, I'd like to discuss the qualifications for sedation, and I'll also answer the question as to what is our patient's favorite route of sedation. All states require proper qualification for the administration of the various means and levels of sedation. There are differences amongst the states, but they all share many of the same regulations. Mild sedation has the fewest requirements since the doses given are many times prescribed by MDs on an ambulatory basis for at-home use without monitoring. If used within the prescribed guidelines, mild sedation is quite safe. Since all states are different, I can only speak for the regulations for the Commonwealth of Virginia. Oral conscious sedation, you need 18 hours of approved education with 20 virtual, not live, but 20 virtual patient experiences. This is a level for moderate oral sedation. IV conscious sedation, you need 60 hours of approved education through an accredited agency such as a hospital or university with the treatment of at least 20 live patients under supervised instruction. Again, if kept within the prescribed intended level of sedation, it's very safe and effective. Deep sedation and general anesthesia are generally administered only by licensed oral and maxillofacial surgeons, certified registered nurse anesthetist, and anesthesiologist. To see the necessary qualifications for each of these specialties or for further clarifications of the qualifications I've listed for moderate sedation, you can Google each individual state board for more in-depth clarification. So the question remains, what is the favorite route of sedation? I can only speak for my patient population. For patients needing only mild sedation, oral sedation seems to work very well. For patients needing moderate sedation, the overwhelming majority get IV sedation, both for its precision, safety, efficacy, and cost. For those needing more, then they need deep sedation or general anesthesia. We strive to offer whatever modality best suits the patient. We work with a team of 3 registered nurses, 3 board-certified anesthesiologists, my staff and I. We feel we can handle most situations for adults. Pediatric sedation is another matter, and we refer to the appropriately trained specialist. Our fee scale depends on the level of sedation. It's less for mild sedation. Our fees are roughly the same for oral or IV moderate sedation. At this time, I'm keeping the moderate fees basically the same, whether it's oral or IV. Even though there's much more involved on our side for IV, most patients, hands down, opt for the IV route. If we utilize the services of an anesthesiologist, obviously the fee increases, but for those who need it, it's worth the additional fee. The bottom line in my practice is IV moderate sedation. It works for probably 98% of our patients at a very reasonable fee. It generally gets the job done quite nicely. I have roughly 300 certified hours in sedation and emergency protocols. I'm certified in the Commonwealth of Virginia to administer nitrous oxide, oral, and IV moderate sedation. I received my IV training at Albert Einstein Medical School, earning 90 didactic hours and treating 46 live patients. I received my Advanced Cardiac Life Support or ACLS certification annually, and my entire staff is Basic Life Support BLS certified and trained. Sedation is an ever-evolving practice. We are always striving to improve our practice and the art and science of sedation.